A relatively quiet scene out here compared to what we've seen over the last hour or so. People really headed down towards City Hall to become a part of that rally. One thing we have noticed, though, that's really struck me is we've met people who are coming to this CVS right here in the corner, wanting to get their medicine and realizing that they don't have anywhere in the neighborhood to do that. And we also met another woman who had to walk blocks away to get paper towels and baby diapers because the CVS that she goes to is now closed. So that's really a sad situation. I want to bring in Danica and her 5 children who are out here are going to be part of this rally this afternoon. Tell me why that's important to you to do that with your children.
Because of my children's future. This what's happening now, it affects them.
Tell me how your children process this, because they're young and they obviously see what's happening in their city.
Yeah, it's kind of hard, but if you teach your children what to do, you know, or what's going on, then they know better. They'll know better, they'll learn better, they'll raise better.
And speaking of teaching your children, we hear from so many parents who are saying that they don't trust the police. How do you break that down to your children? What are their views on police officers right now?
Well, they kind of still believe in officer friendly, but it's hard. It really is hard when you have some officers out here that's not officer friendly anymore. But you have to just teach them what's right and what's wrong and to obey the law, first of all.
And this decision yesterday by the state attorney to charge the police officers, how did that make you feel?
It made me feel okay, but it's just the beginning. We have a long way to go here in Baltimore, and with justice, we have a long way to go.
And one thing I've noticed when you're standing here with your children is we see these Humvees drive by, these National Guard Humvees, 5, 6 in a row. It almost feels like you're in a war zone. What do you think is their impression of that? That's got to be hard for them to process.
It's kind of scary to them because their children are young, they don't know what's going on, and then it seems like that they're coming in and taking over our city. We just want freedom, we just want peace, and we just want justice.
Do you want the National Guard to remain here? Do you think they need to still be here?
No, I don't think so. No, we don't need them anymore. I don't think we need them anymore.
And one last thing, ma'am. You were telling me you're from this neighborhood, you have family still here. Yes. Let's talk about the CVS, because while we've been standing here, people are coming here trying to get their medicine.
Yes, I have a great aunt that lives up the street, another aunt that lives around the corner that comes here to CVS and get their medication, but now they don't know where to go. They have to go further, which with their medical reasons, they can't really go that far. They don't have transportation. It's really hard for them, so I hope CVS comes back, but it's sad that they had to be burnt down.
Yeah, we remember those images of it burning. Did your kids see that? What did they think?
Yeah, they did. They did. They were heartbroken. They were.
Can they understand?
I tried to tell them about it, so they kind of getting it a little better. But yeah, it's hard.
And so you all, what's your plan now? You're going to walk towards City Hall together?
Yes, we are. We're going to walk down to City Hall.
Okay, thank you, ma'am. I appreciate it so much. Have a safe walk. You hear from this woman and her 5 children. Want to be a part of this, upset about the CVS, which is what we are hearing over and over again on this corner. She speaks of her great aunt who now won't have a place to get her medicine, to get the things she needs to survive. So really a developing situation down here. We're going to send it back to Ashley and Charlie.
All right, that was Brian Endon down in one of the central focal points from Monday's riots, that being the intersection of Penn and North Avenues. Ashley, we've been talking about this now, the CVS that was burned in the midst of those riots. You have some information about that, as now we're learning there are other organizations who are trying to help those people affected by this get the prescription meds.
That's right. Actually, you know, we talk about that CVS, but there's 13 pharmacies that have had to close and remain closed because of what happened earlier this week. And so the Baltimore City Health Department is reaching out and wants people to know that you can call 311 and they have a contingency plan in place. They will help you get your prescription medications that you are not able to get if you live in those areas. Again, 311, that is how you can set it up with them, and they will help you, because as we talked about earlier, the nation has watched this, and they watch the buildings go up in flames. They watch the looting, but what they don't see is the little things and how a neighborhood is affected. Those people who are not out there damaging these places, they're really the ones who are probably hurting the most, who now cannot get what they need from these stores.
The unintended consequences of what's happened over the past 7 days is something that will be far-reaching. Some economists are estimating now what happened in Baltimore City will impact this area for as much as 5, 10, possibly 15 or 20 years. So unintended consequences of what you're talking about is something yet to be determined. Perspective. The ball game alone that was empty Wednesday at Camden Yards cost the city and the Baltimore Orioles for 4 hours $1 million. So mushroom cloud that out. Let that come out in ripple effect to everything else that happened throughout the course of the city over the past few days.